Dear students, welcome back. In the previous session, we have discussed about ventral branches of abdominal aorta. Now in this session, we are going to discuss about the lateral branches of abdominal aorta. As we know that the lateral branches of the abdominal aorta are inferior phrenic arteries, a pair of inferior phrenic arteries, and middle suprarenal arteries, and then the renal arteries and gonadal arteries. These are called as testicular artery or ovarian arteries. And on the posterior side, we have 4 pairs of lumbar nerves that we have already discussed in the abdominal aorta. Now we will see one by one what are the branches and the course of this lateral branches of abdominal aorta. Now we will see the first one, that is inferior phrenic artery. Inferior phrenic arteries arise from the aorta just above the celiac trunk. So here this one is the celiac trunk. So above this celiac trunk, a pair of phrenic nerves, that is inferior phrenic nerves, arise just above the celiac trunk. Each artery run upwards and laterally. That means on both the sides, right side and left side, each artery runs upwards and laterally. This will run upwards like this and laterally. Upwards and laterally. Here, on the corresponding crest of the diaphragm. So corresponding crest of diaphragm means on the left side left crest and the right side right crest. Like that. So these arteries run upwards and laterally on the corresponding crest of the diaphragm. Medial to the suprarenal gland. Here you can find, this is the kidney. Over the kidney, above the kidney, you can find the suprarenal glands. So in relation to the suprarenal gland, so these arteries are present medial to the suprarenal gland. Now each inferior phrenic artery will give 1 or 2 or 3 superior suprarenal arteries. So they will give arteries. So this one is called as superior suprarenal arteries. So each artery gives of 2 or 3 superior suprarenal arteries, and then it is distributed to the diaphragm. So it moves upwards and it distributes to the diaphragm. So the inferior phrenic artery gives 2 or 3 superior suprarenal branches, that is suprarenal arteries, to suprarenal gland, and then it is distributed to the diaphragm. Next we'll move on to the next one, middle suprarenal arteries. Middle suprarenal arteries. So where this middle suprarenal arteries are arising? So these middle suprarenal arteries arise at the level of superior mesenteric artery or just above the superior mesenteric artery. So here, so we can see here, these are the superior mesenteric arteries. This is celiac trunk and this one is superior mesenteric artery. So this middle suprarenal arteries passes laterally and slightly upwards over the same corresponding crest of the diaphragm, and it finally reaches to the suprarenal gland. So this artery is called as middle suprarenal artery. So this is middle suprarenal arteries supply the suprarenal gland. Next important arteries which are arising on the lateral aspect of the abdominal aorta or the renal arteries. Renal arteries are large, which arise from the abdominal aorta just below the level of the origin of the superior mesenteric artery. Here you can see these are the renal arteries. Okay. So these renal arteries arise just below the superior mesenteric artery. So this one is right kidney and a left kidney. This renal artery supplies to the kidney. By the name itself we can identify this artery will supply to the kidneys. So the right renal artery passes laterally behind the inferior vena cava. So as we know that on the right side to the abdominal aorta, inferior vena cava is present. So this right renal artery passes laterally behind the inferior vena cava. So for example, this is the inferior vena cava. So this renal artery will pass behind the inferior vena cava, and it reaches to the hilum of the right kidney. It reaches to the hilum of the right kidney. That is the opening of the right kidney. Next, if you see the left renal artery, which runs behind the left renal vein. So this inferior vena cava will give a pair of veins. So that is right renal vein and left renal vein. Behind the left renal vein, this left renal artery runs, and also the splenic vein. So the left renal artery runs behind the left renal vein and the splenic vein. So each artery on the right side and left side, it gives off inferior suprarenal arteries. So here you can find a branch which is come from the renal artery, that is inferior suprarenal artery, which supplies the suprarenal gland, and it also gives branches to the ureters. From the kidney you can find this ureters like this, isn't it? Yes. So it will give branches to the ureters also, and finally distributed to the kidney. So what are the branches from the renal artery? So each renal artery gives a branch to the suprarenal gland, that is inferior suprarenal arteries, and ureteral arteries on the right side as well as the left side, and finally it supplies to the right kidney and left kidney. So these are all the branches of the renal artery. Okay, next, and finally we will move on to the gonadal arteries, which is these gonadal arteries are testicular artery and then the ovarian arteries. Okay, so here you can find this testicular gonadal arteries, a pair of gonadal arteries. Actually it arises from the ventral aspect, but because of its course and it is also paired, they have considered under lateral branches here. The gonadal arteries are small. So here you can find these are the gonadal arteries, are small and arise from the front of the aorta and below the origin of the renal arteries. So below the renal arteries, this gonadal arteries will arise. Each artery runs downwards and laterally. Each artery runs downwards and slightly laterally. So on the either side of the lumbar vertebrae will have the psoas major muscle. So and this artery will move slightly laterally on the psoas major. On the right side, the artery crosses in front of the inferior vena cava. Normally, so again on the right side of the aorta you'll have the inferior vena cava, so it passes in front of the inferior vena cava. Which side? On the right side. Okay, and also the genitofemoral nerve. It also crosses the genitofemoral nerve, and then it passes deep to the ilium. So here you can see the ilium. Okay, so and just ilium, and passes. So this is about on the right side. If you see on the left side, this artery crosses in front of the ureter. So the artery crosses in front of the ureter and the genitofemoral nerve and passes deep to the colon. On the left side, the artery passes deep to the colon. Okay. So this is the variation seen in the right side and left side gonadal arteries. These gonadal arteries may be testicular artery or ovarian artery. First we will see the testicular artery. This testicular artery joins the spermatic cord. So here you can find the spermatic cord. Okay. So this spermatic cord at the deep inguinal ring. So here this is the deep inguinal ring. At the deep inguinal ring, this testicular artery joins the spermatic cord at the deep inguinal ring and traverses in the inguinal canal. Within the cord, it lies anterior to the ductus deferens. Okay, at the upper pole of the testis, it divides into branches which supplies testis and epididymis. So this is the course of testicular artery. If you see the ovarian artery, so we can find the ovarian artery here. Yes. So this is the lower part. So on the left side, so this is the ureters. Okay, this is the ureters. So on the left side, the gonadal artery crosses in front of the ureter. So here you can find this artery crosses in front of the uterus here. Okay. And then this ovarian artery crosses the external iliac vessels at the pelvic brim. So here you can see the external iliac vessels. So here these are the external iliac vessels. It crosses the external iliac vessels at the pelvic brim to enter the suspensory or infundibulopelvic ligament of the ovary. So here this is the ovary. Actually this is the retracted uterus. Normally the uterus will be present like this and the ovaries is present like this. Okay, so this one is retracted here. So here the ovary is exposed well here. Okay, so it reaches the finally to enter the suspensory or infundibulopelvic ligament of the ovary. Okay, and it thus enters the broad ligament and runs below the uterine tube to reach the ovary through the mesoovarium. And this artery gives a branch which continues medially to anastomose with the uterine artery. So here you can find this uterine artery. So here this is the uterine artery. You can find this uterine artery where it is getting anastomosis here. Okay, and this one is the uterine tube. Got it? So the artery gives branch which continues medially to anastomose with the uterine artery. Okay, and supplies twigs to the uterine tubes. So here you can see the uterine tube, small twigs it is giving for this uterine tube, and the pelvic part of the ureter, and it also gives some branches to the pelvic part of the ureter also. Okay, so this is about the ovarian artery. Okay, so these are all about the lateral branches of abdominal aorta. Okay, and if you see some of the common iliac arteries, okay, Common iliac artery. So these are the common iliac artery. Yes. These common iliac arteries are the terminal branches of the abdominal aorta, beginning in front of L4 vertebra and 1.25 centimeters to the left of the median plane. On each side it passes downwards and laterally and ends in front of the sacroiliac joint at the level of the lumbosacral intervertebral disc by dividing into external and internal iliac vessels. Okay, this external and internal iliac vessels are divided at the level of lumbosacral intervertebral disc. Okay, and if you see the right common iliac artery, this is the right common iliac artery and this is the left common iliac artery. The right common iliac artery passes in front of the commencement of the inferior vena cava. The right common iliac vein is posterior to, so behind this you can find the iliac vein. So here you can find this iliac vein posterior to the vena cava above and medial to it below. You can find this right side like this. How this one? The right common iliac artery passes in front of the commencement of the inferior vena cava. The right common iliac vein is posterior to the vena cava above. So at the above it is posterior and below it is somewhat medial. So here you can find it is medial and above it is posterior. Okay, if you see the left common iliac artery, this left common iliac artery which is shorter than the right artery, it is crossed at its middle by the inferior mesenteric vessels. The left common iliac vein is medial to it. So here you can find, so the left iliac vein is medial to a left common iliac artery. So this is the difference between right and left. Okay. The structures lying on the left ala of the sacrum, that is sympathetic trunk, lumbosacral trunk into lumbar artery and obturator nerve are deep to it. So if you can, the structures which are lying on the ala of the sacrum, we can find all these structures. Okay, so this is all about the common iliac arteries also. In the next session, we are going to discuss about the inferior vena cava. Thank you.